Welcome. So this is going to be a discussion of roles and responsibilities for BTEC Health and Social Care, Unit 2, Working in Care. Now, I'm going to talk a little bit about roles and responsibilities. This is A1 and A2 of the teaching exam unit. I am going to cover it quite briefly, so it's not going to be a full detailed coverage of it, but it kind of hopefully gives you an idea of what we're looking at in this topic. So the first thing about this is roles. What is a role? And essentially a role is it's the beliefs, the attitudes, the mannerisms, the patterns of behaviour you would associate with a particular job, position or status. Responsibility refers to often the duties, the requirements of a professional in carrying out their role. All professionals will have responsibilities they follow, and there will be particular social policies or procedures within an organisation such as health and safety, quality and diversity, which all professionals will have to comply with, no matter what profession, field or specialism they hold. But that will be something I will talk about in a separate video. So if we look at healthcare professionals first of all and who they are and what they do. So the doctor, the role of the doctor is, there are lots of different types of doctor. So they may provide medical care to patients and surgeries. They will diagnose illness, they'll prescribe medication and treatment, they'll make referrals for patients, they'll have to maintain confidentiality and liaise with a multidisciplinary team. Nurses, again, there are so many variations of nurses. So again, these can be paediatric nurses, district nurses, community nurses, nurses that specialise in a particular illness or health. All of them are trained to carry out medical procedures, support doctors and provide treatment to patients. The responsibilities of a nurse would be to observe the patient, administer drugs and medication, carry out investigations, provide care, act as an advocate. For midwives, again, their role is to support women during pregnancy, and particularly prenatal care and postnatal care, so care for prior to the baby and after the baby, but also to assist during delivery and labour. Their main responsibilities: support pregnant women, provide the antenatal postnatal care, assist during labour, and also again it's kind of filling in that paperwork, carrying out observations, monitoring the development of the baby and women's health. Healthcare assistants are trained to provide personal care to patients, whether that's in a hospital, a care home or within a patient's home. Their main role is, and their responsibilities, is to monitor the patients, maybe take samples, carry out observations, carry out health checks, but also assist them with maybe more practical tasks like washing and dressing, or assisting with their mobility and other forms of support as needed. And last but not least, you have occupational therapists. Now, occupational therapists, their role is to facilitate recovery and overcome barriers to care. They will make an assessment on the patient's abilities and provide the level of support or arrange support plans to be put in place for them to recover. The main healthcare settings that we will look at, you've got GP surgeries, which would be your primary care, the place most people go to when they have a health concern. You have hospitals, which is often more of a secondary care system, so you generally are sent there after referral by a GP or a specialist, but you may access them directly, particularly if you went to A&E. Clinics would be part of the tertiary care system, so again, often you've been to a GP, you've maybe been to a hospital, and at that point you're referred on to another agency, and that might be a very specific or specialist form of care being provided. And last but not least, healthcare can also take place in the home. So it's provided in a household, and patients are often treated by community nurses, midwives or GPs carrying out home visits. When it comes to social care professionals, again, we have people working outside of the care sector in the community, and often they're providing support rather than medical care. Healthcare professionals are often providing a medical-based treatment. So I'm going to do the first two videos. I've got care manager and care assistant. Now, a care manager runs a care home, and that could be a nursing home, a residential home, it could be a day centre, community group, but essentially they run the day-to-day workings of that operation. Recruit staff, control the budgets, they establish the policies and procedures. Their responsibilities: to ensure the staff are trained, they provide a quality of care, records are maintained, legislation is followed, and they have the right number of staffing for the day. Care assistants are people who work in these care centres. They are supporting the patients, the clients, the people using them. And again, their routines, their responsibilities would be to carry out support, complete daily tasks, liaise with other professionals, maintain confidentiality, but it's also a responsibility for the workers to ensure they have the right training, they have the right issues and support needed to assist the patients. A social worker is slightly different. Their role is to work with people of all different ages, different needs, different ranges of support, and essentially it's to make assessments, look at their environment, make judgments on whether it's suitable to help them develop, keep them safe, and ultimately to work with them to meet their needs. Support workers generally slightly different to a social worker. A support worker will offer support to people with a day-to-day need or a particular form of support. Generally, social workers may make a judgment that someone needs support and it'll be the support worker fulfilling the role. In the same way, occupational therapists might make an assessment on someone's ability and then other agencies will provide the support. And last but not least, you have youth worker. So again, youth workers, they work specifically with people aged 11 to 25. Their role is to support them, help them reach a goal, encourage and monitor their progress. Generally, this may be done through projects. It might be through offering support and advice on different topics. They may act as a mentor or an advocate, but they're often working with younger people. And for last but not least, the care settings. So residential care is a setting where adults will go, or children can go, if they need 24 hours of care. And again, these users are generally specialised to provide that care. Domiciliary care, known as home care, this is the same level of care being provided, but often it's more likely to be done in a client's home than a unit. It could be short term, it could be one visit a day, it could be several visits a day. And we have daycare centres or daycare units. So again, these are often specialist centres where people with a particular need or support need can go on a day to receive that support, but also to make friends, to get stimulation, to have a change of environment. And it might also sometimes be used to give respite to carers. So there we have it. So a very brief introduction to roles and responsibilities. As I say, I will try and make more follow-up videos looking at these issues and also trying to build on this. As I said at the beginning, this is a very narrow view of health professionals and social care professionals. So do make sure you are looking at your materials, you're talking about these topics with your teachers, and also just maybe doing a little bit of research, because there are so many different healthcare professionals and different levels of support being provided. So these are always really good to know, particularly for a lot of 2-mark questions at the beginning of exams. Okay, and there we have it. So hopefully this has been of help. Like the video, subscribe, and tell your friends.